It's the end of April. We will be going into May this week, and with that, I have a few updates I want to share with you, in addition to the update that is pretty obvious based on the title of this video. This past Tuesday, my nurse manager informed me that I will be off of orientation by the end of June going into July for most of the service lines. I still have orthopedic and cardiac surgery to train on, but I will be completely on my own with general, GYN, urology, and plastics going into the summer. And it's finally refreshing given that I feel like it's been a very long time since I was undergoing training in this unique specialty in nursing, but it's finally a relief to know that I will be on the staff and I will have to renegotiate my schedule. One of the things though that does come with it is taking call, so I will have to take call that I didn't have to take in my training. Other news is I took another entrance test for the Medical University of Warsaw this past Saturday. Actually, it was yesterday. It was a basic high school level entrance exam, and I was really confused as to why I needed to take it because I took college level chemistry courses and I did really well in them. However, because I didn't take AP chemistry in high school, the university wanted me to take their version of high school chemistry. Nonetheless, I had to only get, I think, 30% of that portion right in order to be considered for admission. So we'll see where that goes kind of this week when I look at my test and I get the grades back. Other news is I'm looking into moving closer to my hospital. It does get very tiring and overwhelming on you given that I have to spend 3 hours every single day commuting every day of the week and I only have the weekends to myself. So I wake up at 4:45 and it takes like an hour and a half, 2 hours to get to my hospital, and then I have to wait an additional hour and a half to 2 hours just to get back home. And this was all because of the accident and the fact that I'm not able to get another car right now. So my hope is that maybe at the very least I can maybe break my lease early, possibly in July, so that I have time to look for a new flat or a new private room within Cambridge going into the summer. And then I'll probably rent that place out for the rest of this year, and then I'll see what my options are going into next year. Other than that, I had an interview this past Wednesday with the University of Thessaloniki at 4 in the morning. This one was much more quicker and straightforward than the other interviews because it was only a one-sided interview where I was just asked questions by the admissions committee and I wasn't able to ask questions to them. I understand they were having a lot on their plate given the number of students they had to interview. So I can see why it was very quick and very standard. So basically, at this point, I've gotten all interviews from Greece, from the Greek medical programs, aside from the National Kapodistrian University of Athens. And I still haven't gotten interviews from other medical schools yet, but I assume in these coming months, especially going into the summer, I'm going to hear back from them. And then once I get my GAMSAT score back in late May, which is now going to be a couple weeks from now, that's going to give me an idea to see if I'm competitive for the Australian programs and British and Irish programs, or if it's just better to maybe look into the European programs in mainland Europe. And I'll keep you updated. Many thanks and cheers.
Hello, Diane. Good morning.
Hi, good morning.
My name is Dimitrios Narandis. I am from the International Studies Office, Ignatos online Professor Nikolaos Horoglu, and my colleague Anne Saprani. We are here to have a small interview with you. Tell us things about yourself. Who are you and why you want to become a doctor?
Yes, so it's nice to meet you guys. I am Bayar Sayed. I go by Abraham. I've been a nurse for a year and a half now, and I've graduated nursing school last year. And ever since I was in nursing school, I was really interested in becoming a doctor. And I've gotten a lot of clinical experience and I've taken a lot of academic courses in science. And I always wanted to further my education to be a leader in helping patients, making important clinical decisions, and helping out my community. And the reason why I looked into Thessaloniki is because I actually am interested in studying in Europe and I like the curriculum you guys have. And I was interested to see more about it and learn more about it from the faculty. Um, and Europe was always a place I was interested in. I have a lot of Greek physicians at the hospital I'm at, and they encouraged me to apply and look into programs in Greece, such as yours, Athens, and Crete. So that's why I was interested, and that's why I was looking at applying there.
Okay. If I understand the system in the States correctly, if you study there, you have to do only 4 years. If you come here, you have to study 6 years to become a doctor. Why don't you stay in the States and
Well,
save 2 years of your life?
for me, medicine is not about the number of years, it's a lifelong commitment, and I've already committed to studying as as long as it's necessary. The States has a different curriculum. The reason why it's 4 years here is because we technically take our prerequisites, which in the European system are offered during the first 2 years of medical school. But I wouldn't mind going back and relearning some of those courses. The courses I've learned were not in the context of how a physician is taught, but in medical school, you kind of relearn some stuff and you're kind of retrained as to how a physician thinks. I also am not really big fan of the U.S. healthcare system, and I always wanted to look abroad and kind of settle abroad. I still want to pursue medicine, so that's why I'm not really applying to any programs in the U.S. It's mostly in Europe, Australia, England, Ireland, all over mainland Europe. These are the programs I'm interested in, and some of them are 4, 5, 6 years. So the length is not something that's uh, too much of a problem for me.
Okay. If we offer you a place and you come here, you will be about 7 or 8 years older than most of our students in your class. Do you think that this will be a problem for you communicating with younger people?
No, it wouldn't be a problem with communication. In terms of the language, I know you have to speak Greek. Learning new languages is something I actually like doing, so I'm pretty good with Russian and German. I've studied those for a while, and picking up another language um, shouldn't be too difficult for me, especially given that I have a couple years just to be be at the basics and learn the fundamentals. So
Okay. And my last question is, who is going to help you financially with your studies, paying the fees, the housing expenses, everything?
in terms of finances, it's mostly going to be out of pocket. Um, I think Sally Mae and the U.S. Department of Education are other institutions I can look into. I don't know if you guys have partnerships with Sally Mae though. Um, I would have to look into those opportunities for financing. I know some programs in Europe have partnerships with Sally Mae, which give out loans for Americans. I don't think FAFSA does. It takes a longer time to get approved through FAFSA than it does through Sally Mae. But it will be those two companies, as well as my out-of-pocket costs and my savings, that would be the primary sources of funding for the program.
Okay. Thank you very much. Professor Foroglu, do you want to proceed?
I'm sorry about that. Hello. I have just one question. Now you are practicing your profession or not?
I'm not a professor, if that's what you're asking. I'm
No,
practicing.
no, you are a nurse, I know, but are you practicing?
Yes, yes.
Are you working or where do you work?
So I'm a nurse at Mount Auburn Hospital in Cambridge, Massachusetts.
All right. Are you in what department?
Surgery, operating theater. Yeah.
Okay. Circulating or instrumentalist?
I've been trained on both. So I was trained in instrument passing, but now I'm circulating. So I mostly
Okay.
circulate.
So I guess this is a good profession in the world. So it is, there is a need for good hands. Um, that's not an option for you to continue in this field.
In nursing,
Hmm.
yeah, unfortunately, in nursing, it's more like a dead end job. Once you get past a certain point, you're just pretty much going to be doing that same thing over and over again. Most nurses have to go back to school, whether it's medicine or if they want to go into leadership, they have to get a master's. So, in order to have those decision-making skills and clinical leadership skills like doctors do, nurses have to go back to school. There is no clinical pathway once you are already a nurse.
How do you feel about going back to the desk and study?
I always like it. I enjoyed my nursing school. I enjoyed the university atmosphere, and um, I'm I'm kind of in it for the long run. Medicine is a lifelong goal, and even with my nursing degree, I'm always having to relearn new devices, new equipment. So there's never a day I go in the hospital thinking that I've mastered everything because medicine's changing every day. So for me, it's not going to be too much of a shock because I already know that I'm in a field which I'm going to have to study constantly every day and learn new things. And even when I think I know everything, it's only the surface. There's continuously a lot of things to learn. So
I will be honest with you, telling that we have only 60 places per year, and we want to graduate all our 60 students every year. So it is very important for us uh, to select people that will be engaged for the next 6 years. That's a long period of time. So I have a direct question. Do you feel that, as we can say, that uh, that will be fine with you and commit for the next 6 years in this?
yeah, I've done the research for quite some time. I looked into medical schools abroad since like 2022, 2020. Knowing in the European system, it's 6 years. I'll be probably in my early 30s, and then looking into residency options or training options. Um, I'll also be in my mid 30s. So I am aware of um, the length of training, and it's something that I'm willing to accept. It's not an easy path. It's a very long path. Even in the States, it's still, although it's 4 years, it's shorter. Medicine is not something that you can get done in a couple of years. It's not only a lengthy training program in school, it's also a lifelong training program. And that's something that I've always embraced, and I'm certainly committed to those 6 years.
You will have to find out the financing solution because loans are not anymore. They have never been in student loans have never been in very popular in Greece. So you still have to find a solution in finance. Okay, Anna. We don't hear you. Now
Sorry for that. Okay. Hi. Nice to meet you too. So, what kind of doctor do you aspire to be? Not just in terms of specialty, but in how you interact with the patients.
When it comes to the patient interactions, I want to make sure I'm a patient advocate and I am delivering patient-centered care that's also with the highest research in the field. So typically as a nurse, I interact with patients a lot, and in nursing school we were taught about being a patient advocate, making sure we are making decisions that benefits the patient. But at the same time, not every patient is going to have decisions that's in their best interest. So we also have to educate patients and let them know about the proper interventions needed to address their causes. So I really want to be a leader in my community and create programs and help teach other people, other clinicians, other nurses, other doctors, and I want to kind of build from that um, system.
Hmm. How would you describe yourself as a person? What keeps you motivated during tough moments?
During tough moments, typically, I've been in many situations. I always think of the bigger picture, and whenever there's a very difficult task, I always break it down into simple, easy to digestible goals. Time management is something that I'm very dedicated on, so instead of doing something that I would cram or procrastinate in, I would do it a little by little every day. So that way I'm kind of pacing myself and I'm disciplining myself just to make sure I'm consistent with my schedule. And that way I have more of a balance instead of trying to do things all at once. When it comes to difficult situations, I always have friends and family. I call them for support. If it's in the hospital, I have faculty and staff that I can reach out to, and they're usually accommodating. If it's something that I need to take some time off and recharge before I get back into it. So,
Was there ever a moment when you asked for a colleague's advice, support, psychological support?
um, not really for psychological support. So I don't have any psychiatric illnesses, but there have been tough times where I have seen a lot of bad things in the hospital, especially in my clinical rotations. Like I've seen patients dying on my hands, and I've also seen tough situations with parents and loved ones and very tough clinical decisions. And at the end of the day, those can really take a toll on you. But all the nursing instructors and physicians at my hospital, they um, they really reassured me that you're going to have people that are always not going to be in the best conditions, and they're always not going to be able to survive these things. So it's important to take care of yourself as well, and just learn that you can't help every single person. You can try your best. Um, just don't. I think if you focus too much on those things, then they can really get down and bother you. And they said don't let that, because there will be multiple instances that's going to happen. So it's
Okay.
really open-ended conversations and dialogues um, that we have that helps kind of support us in those moments.
Hmm. Have you ever been to Greece?
No, I've been to other parts of Europe though, but not Greece.
Hmm.
I wouldn't mind visiting before I.
Okay. I don't remember if we asked you, have you applied to other medical schools?
I have. I've applied to the Kapodistrian University in Athens,
Mm.
Crete. I've applied to Vilnius, Lithuania, Italy, Croatia, Poland, and next month I'll be applying to Australia, Ireland, and the UK. So
Mm-hmm. Okay.
a lot of schools.
A lot of schools. Okay, Bayar, thank you so much. We wish you good luck. You'll receive a mail in a couple of days now from us. Okay?
All right, thank you.
Thank you. Thank you for
Bye.
being here. Bye bye.
All right, bye.